Blog Talk Radio.
Hello everyone, this is Lori Smith on Blog Talk Radio. Welcome to the show. I'm just doing a special show today. This is on WHO's, the World Health Organization's Mental Health Day, which is today, October the 10th, 2010. And I just wanted to do a show and talk about what I had seen out there regarding this Mental Health Day that, is quite interesting actually. And I think this is so important to talk about the whole issues of mental health and the fact that, the situations that sort of surround it, like stigmas and the fact that so many people are suffering with all kinds of mental health issues, and some don't know where to turn, and some people have tried to get help and just can't seem to get, the proper assistance. And it's such a huge topic. And I thought, we'll bring it out and talk about it. It's something that I talk about quite a bit on my shows, One Child Abuse Survivor to Another, and child abuse prevention and human rights abuse prevention is up to us. Because mental health, everyone's mental health is very important, you know what I mean? And we all, at some point, might face something that really jeopardizes our mental health, right? Which then jeopardizes our physical health, because so many times people who have, suffered through mental health issues, for instance, anything like post-traumatic stress disorder, PTSD, which so many people have suffered from, to, other dysfunctions and just different things that happen to people that could cause anxiety issues, or depression is another one that's huge. So many people suffer with this stuff at some point in their life. They might not suffer through their whole lives with it, but they might at some point in their life suffer through this stuff. And it takes a toll on people. It definitely does. And it's hard on everybody around that person. It's hardest on that person, but then it's also very hard on the people around them. As a society, we just tend to want to push all this stuff under the carpet. Who wants to deal with this? It's just because this is all stuff that's very personal, and it touches people's lives, and it's something that most people don't know. Well, how do we deal with this? It's the same with child abuse issues and the whole idea of child abuse prevention. People are just like, well, why do we have to know about this? Can't we just push this under the carpet? It's like, no, because as much as awful as it is, and hurtful and painful as it is, we have to talk about it to find the answers, right? So I love this, the fact that the World Health Organization has set up a Mental Health Day, and they did last year as well, and I didn't really pay too much attention to it last year. I knew it was happening, and I knew that it was that they were doing that, but I was busy, or I don't know. Oh yeah, well I was busy. I was actually writing my blog, and I was busy with a lot of other things, so I wasn't doing my blog talk shows at the time. I didn't start my blog talk shows till November, later in November that year. So I thought, well, why not talk about it? And you can find this information from the World Health Organization's website for World Mental Health Day 2010 at www.wfmh.org /2010-2010, and then world_mental_health_day.htm. And that's where you can find this information that I'm going to be reading from and talking about. There's some really good information on here, and I hope everybody will go and check this website out. And I popped the link into the chat room. Chat room is open if anybody would like to sit in there, and the link is in there so you can sort of follow along. There's a PDF that we'll be actually looking at, but this first portion is just the actual website web address. And they said World Mental Health Day, October 10th, is fast approaching. The theme for this year is a continuation of the one on integration of physical and mental health from last year, with a specific focus on the relationship of mental health with chronic physical illness or illnesses. So it's a position that the World Federation for Mental Health is promoting in international forums is the need for inclusion of mental health in the emergent and growing emphasis being given to non-communicable diseases. Mental health is intimately tied to the Millennium Development Goals. As these goals are reformulated, we are trying to ensure that mental health is prominently represented, and the burden of mental illnesses is well documented. This year we are underlining the intimate and bi-directional relationship between mental illnesses and chronic physical illnesses such as diabetes, cancer, heart disease, respiratory diseases, and obesity. So see, all of that's interconnected. Mental illness along with its chronic physical illnesses, things, that people are suffering with all the time. And not everyone, thank God, but there's so many people that have suffered or are suffering with this stuff: diabetes, cancer, heart disease, respiratory diseases, and obesity, things like this, right? So it says WFMH, that's the that's World Federation for Mental Health, right? WFMH is developing a program, the Great Push for Mental Health, to ensure that mental health is given priority in all countries. And the connections between physical and mental illnesses and the relationship between these illnesses and human productivity and mortality are key to such prioritization. So these guys are just doing a huge service as far as I'm concerned. They're doing a huge work to try to, in all countries, to promote mental health awareness, education, getting information out to people, really to try to reach those who are not able to access or who just don't know about the different programs that are out there and available. And in many countries, there just is not enough services available, right? I mean, we know North America. I mean, if you live in North America, you have way more services than you would ever have anywhere else, like on the planet. There's, generally, because most other countries don't have the kind of money that North America has to pump into this stuff, to pump into these programs. And most of these other countries really are still so poverty-stricken, or they're just coming out of being poverty-stricken. So they just don't have the money or the funding or even the education and knowledge, the support systems there to get these programs up and running. Whereas North America, even though things cost money and you have to have insurance and blah, 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 you can still sometimes, get in under the red tape there and without money and get assistance to get some of this stuff. You might not be able to access the top-notch stuff, and you might have to kind of go with what they can provide for you, but it's better than nothing, because some of these other countries have absolutely nothing, right? They don't have anything in place for people who have any kind of mental health issues going on in their life or chronic illness. They just have no health care, period. And so North America, man, this is really the place to be, and we got to be thankful for everything that we have, even though the system's not perfect. Well, what is? But we're striving for perfection, aren't we? Like all the time. And that's really what counts. We're always kind of, as a population, working towards making things better. We can't make things better unless people stand up and talk about it, and think tanks get together and start thinking about it, and people start accessing this stuff, right? Then it won't change, and it won't get any better. And that's just the whole issue. It's not. We can't just leave it up to everybody else. We all have to get involved, right? So it says, attached are materials we have developed to support your efforts and initiatives to celebrate World Mental Health Day. It's translated in 8 languages, it says here, and it contains all kinds of materials that they've proven useful, they said here. The prioritization of mental health remains an ongoing challenge, they said. The World Federation for Mental Health established World Mental Health Day to provide an international vehicle for public education. Now we are starting several new initiatives to develop and build the future of mental health everywhere. So, sincerely, that's from Vijay Ganju, Secretary General, CEO, World Federation for Mental Health. And then there's on this link here from www.wfmh.org, you can click on this PDF link, which brings up the PDF download, which is what I wanted to look at, the actual documents. And it's quite interesting. I was reading through there last night and this morning as well, and just tons and tons of information about, chronic illnesses related to and because of or related to mental health, right? It's a direct correlation, a lot of mental ill health and chronic physical illnesses is just completely a direct relation to each other, right? It says mental health and chronic physical illnesses, the need for continued and integrated care. World Mental Health Day, October 10th, 2010. So that's today. So that's why I wanted to talk about this today. I thought, well, why not? Let's just go for it on the day, right? So this is great. I'm happy to see this. So many people need help, and so many people just don't get that help, right? It's very sad. And so I'm just scrolling down through here. They just had they have like a little introduction letter and whatnot. It says, introduction, quite often physical, and this is page 5 of that PDF, quite often physical and mental health disorders go hand in hand. And research shows that persons with severe or chronic physical illnesses often have coexisting mental health problems. At the same time, persons with severe mental illnesses or substance abuse disorders have physical health problems that remain undetected or untreated. This situation, combined with the reality that there is still stigma associated with mental illness and that most persons first seek help through their GP, has resulted in an emphasis on the need for better integration between mental health and physical care, especially for better mental health and substance abuse screening and treatment in a primary care setting. So it says, the World Federation for Mental Health, a 62-year-old international advocacy organization with consultative status to the United Nations, has developed and promoted the idea and celebration of World Mental Health Day last year in 2009. And so they said here, this year we extend and elaborate the notion of integration of care by focusing on the connection and relationship of mental health disorders and chronic illnesses. As the World Health Organization has noted, 4 chronic illnesses, cardiovascular, diabetes, cancer, and respiratory illnesses, are responsible for 60% of the world's deaths. 60% of the world's deaths. That's what it's all about. Cardiovascular, diabetes, cancer, respiratory illnesses. That's horrible. And, in my own family, I mean, this is totally it right here. You know what I mean? Cardiovascular problems, not so much cancer, but a little bit of cancer, and respiratory illnesses for sure, and some diabetes. So, it affects a lot of people's families, and I know so many people who have suffered through this cancer and other things, and, it's incredibly hard on people. And so many of us suffer with this stuff, right? And then, of course, there's the whole mental health issues that go with it, depression and it just manifests, and so this is what they're talking about in this document here, and it's 65 pages long, so I don't know how much we'll get to cover of it, but I certainly want to take a good look at it because this is so important for people who are suffering with chronic physical illnesses and possibly some mental health issues too, post-traumatic stress disorder or any of those things like, depression or whatnot. And it kind of goes hand in hand, you know what I mean? So as our understanding of the relationship between these chronic illnesses and mental illness has increased dramatically in the last 2 decades, we now know that persons with these chronic illnesses have much higher rates of depression and anxiety than the general population. Major depression among persons experiencing chronic medical conditions increases the burden of their physical illness and somatic symptoms, causes an increase in functional impairment, and increases medical costs. The presence of mental illness with long-term illnesses impairs self-care and adherence to treatment regimens and causes increased mortality. So it says the bottom line is that mental illness occur with chronic mental conditions in many patients, causing significant role impairment, work loss, and work cutback. They also worsen prognosis for heart disease, stroke, diabetes, HIV/AIDS, cancer, and other chronic illnesses. Many factors point to reasons that mental illnesses are not adequately addressed in this context. Consumer, provider, and system factors all contribute to poor quality of care. Consumers and family members may not recognize or correctly identify symptoms or may be reluctant to seek care. The providers may not have the right training, equipment, or support to provide appropriate interventions, especially in other countries. There's just some of these countries around the world that just have nothing. They have no health care systems, and if they do, they're very minimal. So systems may have constraints and limitations related to financing and the availability of access to mental health treatment. But even in this country, in the United States and Canada, we still have our own problems with this. So it just tells you that even with the amount of money being pumped in, to the healthcare system within Canada and the United States, there's still so many problems with it. It's not a perfect system, that's for sure. And that's unfortunate, but it won't be until we can all get this straightened out. Thank God for the groups like the WHO, the World Health Organization, who are sort of approaching this with this proactive approach. Like, let's get on it, let's do something about it. And so really we all have to kind of get involved where we can to promote this stuff. This is very important. And so they said here the agenda is obvious. Our hope is that these materials developed by the World Federation for Mental Health will boost these efforts. And that's from Vijay Ganju, Secretary General, CEO, World Federation for Mental Health. And so Section 1 is chronic physical illnesses and mental disorders, fact sheets, overviews, and action steps. And it says this year the WFMH is highlighting the global concern of undiagnosed mental and emotional disorders in people coping with chronic illnesses and the need for our health professionals to provide more integrated or collaborative systems of care. The World Health Organization's World Health Surveys indicated that depression has the largest effect on worsening health compared with the other listed chronic illnesses. So depression is, I guess, is listed as being the largest effect on worsening health. So we can just imagine anybody who's dealt with depression of any kind, of any severity, knows just how hard it is on the body and how hard it is on a person and everyone around them. Depression, it says, accompanied by one or more chronic diseases, reflected the worst countrywide levels of health, and these scores did not vary much from country to country around the globe. So my mom was like a prime example of this whole chronic illness thing with the depression and whatnot, because she was diagnosed manic depressive, but she was also very sick, physically ill, a number of different illnesses, heart disease, congenital heart disease. She had hernias. She was just a mess. She had cardiovascular problems. Like her veins would just burst and blood would just pour out everywhere. She was always having these, issues going on. Very, very sick physically as well as mentally. And, she was diagnosed manic depressive and told to get some help, and she just would never get any help. She was abused as a child, and so she went right into an abusive marriage. And so this is the type of thing that can happen to people. And she lived to be 60 something years old, but she was sick her whole life, and it's hard to watch somebody be sick, to be going through that, suffering their whole life, really not getting any help. She was seeing doctors and whatnot, but they just they wouldn't treat her depression. They weren't looking at that. You know what I mean? They were just looking at trying to keep her alive physically, but they weren't so much interested in her emotional and mental health, right? Which they should have been, because had they been able to help her out there, I think that her physical ailments would have, of course, still been there, but she would have been able to probably look after herself a bit better, and would have been able to enjoy life a little bit more, right? So because she was so depressed, she really couldn't enjoy life. And so this is what the problem is. This stuff is a killer. Heart disease is a killer, cancer. We're looking at all this stuff, and it is a direct link to mental health. And mental health, because of the diseases, of course, then is affected. Because if you may have been the most positive, outgoing person in the world, if you end up with one of these diseases, like cancer, heart disease, cardiovascular, illnesses and whatnot, and you end up with one of those, you could become depressed, right? And so then, of course, you may have been the most confident person, the most happy person, and then all of a sudden you're brought, to a halt because of these diseases. And if you don't get some help, you can really spiral downhill quick because of the depression and just the whole fear and anxiety behind it. Or a person could already have had mental health issues and been very healthy, and then have an illness come upon them, and then it just gets worse. Because, so they kind of go hand in hand, I think, just by looking at the material and looking at what I've read in the past about this stuff and what I know personally from what I've seen in other people's lives and in my own life, right? So they said non-communicable chronic long-term diseases are now the leading cause of deaths worldwide. Dr. Gordon Galea, UN WHO, coordinator of health promotion, has noted that for chronic diseases, cardiovascular, diabetes, cancer, and respiratory illness are responsible for 60% of the world's deaths. And 80% of these deaths are happening in the poorest populations of the world. So you can imagine, that's just, these poor countries, these third world countries that are just so poor, so poverty-stricken. That's where the worst of it's happening, because there's no help for them there at all. Period. They just live their lives and with no real care or health care, and they're on their own pretty much, right? So if nothing is done, experts estimate that we could witness another 388 million people die prematurely within the next 10 years. The prevention or management of these chronic illnesses has attracted more attention over the years because of its apparent impact on mortality, health resources, quality of life, and its economic burden to governments, healthcare, and families. This is one of the many risk factors associated with chronic illness is the emotional impact on people who are ill and their families. Many chronic illnesses can have a strong effect on an individual's mental and emotional status, and in turn, undiagnosed mental disorders can affect a person's ability to cope with an illness and participate in the treatment and recovery process. So Catherine Powers, MED, Director of the Center for Mental Health Services, U.S. Substance Abuse Mental Health Services Administration, that's SAMHSA, states that, quote unquote, we know that many individuals with chronic medical conditions have untreated comorbid mental illnesses or substance use disorders, and this can complicate their recovery from both conditions. So that's what she said. It says, learning to cope and live with any long-term condition is stressful for most people. Persistent, unrelenting stress often leads to anxiety and unhealthy behaviors. It is not uncommon for patients and family members to have prolonged periods of anxiety about the effect the illness will have on their lives. Indicators of anxiety include physical symptoms such as difficulty breathing, chest tightness, shakiness, headache, and dizziness. Psychological symptoms of anxiety, such as fear of what will happen, include worrying about who will care for you and how the illness will progress. What you feel and think and how you deal with those emotions can affect your ability to cope with a long-term condition in many ways. And it says depression has often been referred to as a normal reaction to an abnormal situation. So therefore, it is not a surprise that depression is the most common complication of almost all chronic or serious medical conditions. It says the risk of getting depression, quote unquote, is generally 10 to 25% for women and 5 to 12% in men. However, those with chronic illness face a much higher risk, between 25 and 33%. Research has shown that depression often causes changes that can worsen a medical condition and reduce the needed energy necessary to cope with changes in treatment schedules, creating a vicious cycle of worsening physical and emotional symptoms. Well, that's just it, because then all of a sudden, if these people, whoever these people are, if they have children, there's always the thought of, well, who's going to look after the children, right? If I have to go for treatments or end up in the hospital because of this illness, then we have to worry about the kids. Will the kids get this illness? There's just so much... There's so much to it, you know what I mean, that people have to deal with. Okay, who's going to foot the bill? Is the government, do I have enough insurance for this? Am I covered? Well, is this going to bankrupt us? Back in, when my mom was sick, she didn't have any health care down in the States, and so, she would have to foot the bill for these hospital visits, right? And they would cost tens and tens of thousands of dollars, right? And there was no way she could pay them, you know what I mean? But she'd have to sign on the dotted line that she would pay them. So she was basically paying a fee all the time to the hospitals of hundreds and hundreds of dollars for her whole life, because she could never pay it off, right? But the thing is she'd have to keep going back in, and it would just cost more and more. And she didn't have health insurance and didn't qualify. We were $2 or something over the line to qualify for assistance. I mean, we were that close to being poverty-stricken, right? So, but they wouldn't, because my dad made $2 more. I think, it's too bad they couldn't have done something about that and just lowered his wage a little bit, because we could have got some help. But the thing is, I guess, they couldn't do that. So my mom would have to put her prescriptions on her credit cards because she had no health care whatsoever. So all of her prescriptions, which she took a massive load of prescriptions, let me tell you. I forget how many hundreds of dollars it's costing her per month. Now today, looking at this, 20 years later, let's just say, or 30 years later, 20, 30 years later, those prescriptions would probably be in the thousands because of the cost, the change of the cost of living, right? So you can imagine, she was putting this on her credit card. So then she was having to pay the credit card bill. So my parents were always strapped, financially strapped because of my mom's illnesses and sickness, right? And one time I had to take her into the hospital. This was back when I was in my 20s, and she was just in her late 50s. And I was taking her into the hospital because she couldn't breathe, and we were thinking that she was having a stroke or something. And they wouldn't help her unless she signed on the dotted line that she would pay for the visit. Well, she was so sick she couldn't breathe, and she was in a wheelchair. And they were like, we're not taking you in until you sign. And she couldn't even hold the pen. She was really half out of it. She was dying on the spot, right? So I was like, she can't sign because she's dying. If you don't get her some help, if she dies in the chair here because you won't help her, you got a lawsuit on your hands, buddy. And they were like, well, you sign. So I had to sign, right? So this is just the thing, right? They don't want to help people that don't have insurance. And even today, they will sometimes refuse treatment in the United States. Now, in Canada, that's just not the case. They might make you pay for it, but they'll take you in if you don't have insurance. They won't refuse your medical care. They will charge you for it if you don't have insurance. But down there in the States, I've actually heard of hospitals actually not allowing a patient to enter if they won't sign that they'll pay for it. It's absolutely ridiculous, and it just makes me sick to my stomach to think about it. But this is the problem, and this is what the problem will continue to be until we get enough people standing up and saying it's not right and we need something done about it. So the next portion of this article is heart disease and depression. Now, the heart disease, my family suffers with heart disease. It's a serious issue, and so many people suffer with heart disease, and I think I've got heart disease. They did want me to see a heart specialist like 15 years ago, and I really just didn't want to bother. You know, I was born with a hole in my heart, and my mom had heart disease, and her mom had heart disease. It's just something that runs in the family. And, you know, I'm just like, well, I'm just one of these people that fits right into this article because I don't want to go get treatment, and there's a lot of different issues surrounding it. There's a lot of reasons why I don't. I almost feel like I spent my whole life taking my mom to the doctors. I'm sorry, I'm really tired of sitting around doctors' offices and waiting for people to come out. And not only that, but my sweetheart is terminally ill. If I get sick and have to go into the hospital for treatment, let's say I have to go in for some, to keep proactive treatment, to keep me healthy and whatnot, who's going to look after my sweetheart? You know, because I'm very much sort of a part of his life and looking after him. He's terminally ill. He's been dying. He's been diagnosed 9 years ago. He's still alive, thank God. But, I'm more concerned about his health right now than mine because his health is more of an immediate issue as far as we know. He doesn't have, who knows how long he's got left, but he is on his last, he's on morphine, and eventually he'll be using the shots, and he'll be bedridden and stuff. And so I'm more concerned with his health right now. So this is the whole issue. This stuff can affect so many people, and they don't go get help for so many reasons. And I'm a prime example, so I'm not going to sit here and lie and say that, I'm not affected by this. Like, this is totally this article is definitely for somebody like myself, right? To sort of see, look how many people there are out there in the same situation, and why this happens to people, in a country where there's just tons of health care. I mean, I'd have to go completely reliant on the government to support me while I was going to have any kind of stuff done because I don't have anybody else to rely on financially. So then I'd become a burden to the government because they'd have to pay for my rent and everything else while I couldn't work, and who's going to look after my sweetheart? So there's so many issues that surround this stuff, you know what I mean? And it's not always just an easy answer to everything. Sometimes people always have an easy answer for you. Oh, you should do this or you should do that. And it's like, well, have you walked 2 minutes in my shoes? Because I don't know if you could. It's not an easy pair of shoes to walk in, let me tell you. And but you make decisions and you make choices and you do things for certain reasons, and at the end of the road, if you're okay with those decisions, I think that's all right. But if you're not, and then you need to go do something about it, right? And so many times people could go do something, but they just don't. You know what I mean? So down the road, when things will be different, I probably will go do something about the whole issue. And I have a lot of work to do. I got to get some work done on my ankle as well. It's an old surgery of mine, which is decrepit. My ankle's falling apart, and it's very painful, and I need to go get something done with it. And there's things that I got to go do, but right now it's not going to happen. But this is the sort of stuff that this happens to people all over the world, and thank God in these countries, Canada, the United States, and other places around the world that have good health care, we can get help. But think about places like, for instance, any place that's just extremely bad off right now, like Afghanistan. I think Afghanistan has 2 hospitals in the whole country, 1 or 2 anyway, and they just have no health care. And the people that are suffering from mental illnesses, they just on the street, they're just left to their own demise. Nobody tries to help them, and it's just so sad. They generally are the mobile population, especially if they're children, and then they're just misused, mistreated. A lot of them are on drugs, different types of like opium or whatever they have over there, heroin, and they don't have any substance abuse programs over there. So yeah, that's just one country. I mean, you just pick any country in Africa. There you got a pretty good example of what's going on around the world with chronic illness and mental health and the whole issues of people not being able to access and get help, people having no help, there's nowhere for them to go, right? So this is a huge issue. Well, this next portion is called heart disease and depression, and the reason I bring it up is because it does affect my family, and it did affect my family, and so this one is very important for so many people. It does affect, right? So depression is in 1 of 5 coronary heart disease, and in 1 of 3 outpatients with congestive heart failure. Yet the majority of such cases are not recognized or appropriately treated. So, like, they'll treat the coronary heart disease or the congestive heart failure, which is what my mom had. They'll treat that, but they don't treat the depression to go along with it. And my mom was very depressed. She was diagnosed manic depressive. And they wouldn't, there was nobody kind of to sort of push her to get help for her depression, right? And, I mean, she did have some good years in there, too, where she was feeling pretty good. And then she had some bad years, and I mean, I was sort of present for all of them. And sometimes she was able to pull herself together, and other times she was just not. And it was incredibly hard to be around somebody like that because you already knew, like, she was sick and suffering. And yet there wasn't much you could do to cheer her up or to help her feel better because she was so depressed, right? And she couldn't even help herself because she was depressed, right? So major depressive disorder is a risk factor in coronary heart disease events in healthy patients. So this is the whole thing. See, I mean, who knows whether depression really ran in our family or whether it was caused because of abused as a child by her mother. Her mother was a horrible woman. She may have abused herself. I don't know. My grandmother, I don't know much about her childhood, but who knows? It seems to me, how could she be a hateful person if she didn't swear that she was probably abused herself and passed it on, the cycle, right? And who knows if the depression actually is part of it, or you know, like genetic almost, or if it was because of the lifestyle. Then my mom was very mental ill. Dad is borderline from depression, and he's got problems. Guy thinking that this guy is able to take away all their problems, and they're going to great marriage. Turned out to be the most worst, thing that I have to do. Being love, no lack of, there was just no concern for her at all. My dad, and we suffered greatly in that marriage. I suffered as a child and then suffered as a married woman in his family, and it was actually depressing for her. And it all got passed on to us as well through the abuse stuff. This is a prime example of what happened. So who knows if she really, if it just ran out, or if it was just us, but anyway, because of the heart disease that my mom had, was fighting disorder. She couldn't breathe half the time, couldn't focus, she couldn't function, and it had so much depression and going on around her all the time. She was part of, she wasn't like she was part of it. She was the other half of the leader, right? My dad was abusive as well. And but it was very, very hard. So it's a big factor in the development of heart disease events and help patients. And for adverse cardiovascular patients with established heart disease, people with heart disease, depression, increased risk of such a heart attack or blood clots. My mom went these major problems. Her legs were open, and it was just horrible. You should just start bleeding and just blood and stuff. People who have heart can also increase their risk of heart attack and development of coronary artery disease. See if you can increase risk. No wonder, because when you're depressed, keeping yourself all bundled up, the flow is not go right. The breathing isn't going to be good. I've been there. You're just sort of you just have function, not breathe properly, down. You're set up tight so the body, all these different things come through the body. They talk about there. I hope that you will too. www.wfmh.org /2010-2010 docs DOCS /WMHDY 2010.pdf. You can just go get this by just going to the World Federation for Health.org, WMH.org, and it's a great PDF. It's there's lots and lots of good information on there talking about the whole issues of what happens to the body when it becomes stressed out, what's going on in the body that actually, because of the mental illness, that causes these physical ailments to be worse. You know what I mean? And so people realize that it does have an effect on people, and it does have an effect on your body, on your health. The same kind of patients with cardiovascular disease end up to 20% of patients who have undergone coronary bypass surgery experience major depression. So no wonder, because up to 15% of patients with cardiovascular disease and up to 20% of patients who have undergone coronary bypass graft surgeries experience major depression. Well, it's no wonder. It's that whole, you're just kind of, you can't probably breathe properly, you don't feel good, energy levels be down, and then there's a whole illness is getting worse. How's this going to affect my family? How's this going to affect my wife? So many people have to work, especially in North America, because jobs are there. We want a roof over our heads, we want to have food, be able to do things, have a car, help our kids go to college, school, whatnot, and these people who are experiencing this stuff, having children try to get their life going and doesn't get with this disease and have to go to these coronary bypass surgeries. They're like, oh my God, how is it going to affect my life? How is it going to affect my world, my family's world? It can cause depression, these continued depression, risk of death, mortality, to 17% within 6 months after a heart attack, versus 3% mortality, heart attack patients, depression. It's quite interesting. My sweetheart is terminally ill. He's terminally ill now since 1. And so this year will be 10 years. And he was diagnosed, he was given 2 years to live. He was diagnosed with disease, terminal. Right, he was given 5 years to live without a liver transplant. And he didn't let it get him down. Like that's the whole. He did not get depressed about it. He does have his moments where he break down a little bit, but mainly he just lives his life, and he's just always been like that. He's a trooper. He just lives his life. Figures that he can't. There's certain things he can't control. So what he does is he just controls what he can control. That's how he feels. That's how he gets through his day, and how he feels about things. And so he keeps a pretty level head. And so the doctors were saying, whatever you're doing, keep doing it, because it's obvious that the longest living patient that we've ever experienced, who's 9 months diagnosed with the disease without a transplant. So whatever you're doing, just keep doing it. And really, it's he doesn't dwell on things he can't. He knows his limitations, those things he can't do. There's lots of things that he would like to do, I'm sure, but he can't. But he doesn't sit and dwell on it. But, he was not abused as a child. He had a very good childhood. He had very good parents who loved him, brought him up properly. They cared about him. They brought him up with confidence and to realize his life is life. We need to deal with it. They had problems. He lost his first 4 of his siblings to us. He was out there, but their 4 siblings were in the house, and the house burned. Well, they didn't burn down, but they died of smoke inhalation. But there was a huge house fire, and so all of his little siblings that were younger than him all died in this house fire, and it really affected the family. But they totally loved. They had more children after him, so he had more siblings. And they totally loved each other, the parents, and they loved their children. And I think it's very important, people who grow up in a certain type of environment where they know their parents love them, they're cared for, they're cared about, they help instill confidence in. They don't dwell on things. They just deal with things when they need to, and then move on. Showing people how, show your family how to call. And I think where my sweetheart is very much, he was just with that, because he didn't look at the problem and deal with the divine. And he didn't dwell on things. The things are feeling like, oh, me, woe is me. He's just not like this. He doesn't feel like life sentence. He doesn't have his disease as this thing that's just, ruined his life. Because, still enjoys his life. That's very important for people suffering through, terminal illnesses and whatnot. Things that really get it down. We can still enjoy life with the gift. And so there's a way we can turn it around to work for us instead of, you have to have that support, and that support is very important. So, he's there to support me, and so he doesn't have a whole lot of other support from too many people, but he doesn't seem to need it. He does quite well without it, but we support each other, and I think that's important, But this is the thing: if you let something like that get you down, it can kill you. You know what I mean? And that's the problem. It quite often does. And they told him, they said, most of the people that are diagnosed after hearing that they're terminally ill and that they only have 2 to 5 years, they go spin off into a depression. They don't take care of themselves. They don't go to their doctor appointments. And my sweetheart is faithful with his doctor appointments. He goes, 2 times a week or something. He has to go to all these different doctors, and he's been going for 10 years. See, but it keeps him alive So he's really my best example, and I should follow after him. I mean, but sadly enough, I do try to take to sort of look at his example and do what he would do because he's doing the right thing. But so many people won't do that, you know, and it's very bad, it's hard on people. The negative lifestyle can support lack of support, interfere with the treatment of heart disease, and this is just typical. I've seen people in my and in my own personal life, lack of being my person, so I like to exercise, walk hard enough. Just for me to work. For me, I have a car, and I have to take people and walk. I'm not complaining about the whole issue. Is very painful. So first step I take hurts every. So even if I have to take to get around, working around the job, to get around home, if I'm running errands at work, every step I take hurts. So it's very painful. At the end of the day, I'm pretty worn out. You know what I mean? It's like my resilience to was something that not bothered me, but it's even less. You know what I mean? It's like certain things that just get on my nerves. I'm like, I'm just tired and in pain, and all that space can be all other. So it's almost like it makes things worse. Active exercise, but I don't want to exercise because my ankle hurts. My body hurts. So the core exercise, this is we're all put ourselves into stuff. All is relates to health. We all know that enough, and the reason is there's so many people who are suffering with this type of stuff, right? It says smoking, excessive alcohol consumption, poor diet, lack of social support. Well, so many times the poor diet is mainly because people can't afford to eat healthy, and even if they don't smoke and don't drink, they're just really lacking in funds to eat a proper diet. It's very expensive to eat the good food. It's cheap to buy the chips and cookies, right? But they're not a good source of anything for a person to live off of. And just a lack of social support. People just spending too much time on their own. They won't reach out and talk to people because of their disease or because they just don't have the energy. And I think a lot of times there's just no energy with these diseases. You think about cardiovascular diseases and the heart disease, congenital heart disease, and diabetes, cancer. All of that stuff wipes a person out, physically and emotionally, right? So it takes extra effort for them just to get up in the morning and say, hey, I'm facing the day, right? You can imagine, and I know I put myself in their shoes, I try to anyway, because I know people who have had cancer and they've survived it, and hallelujah. And my sister had cancer, and she did survive it, and she died not that long ago, a few years back, and she, very sad, but hey, something eventually going to take us all. But the thing is nobody wants to see somebody suffer through that. And I believe kind of hereditary in our family. I think there is some of that ovarian cancer going on, and it's unfortunate, you know what I mean? But we don't have to let that destroy our spirit. You know what I mean? And that's where the whole thing with the mental health thing comes in, right? If a person's depressed, if you know somebody who's suffering in because of their physical ailments, and it looks like, wow, they're so depressed all the time. And then you think, oh, I don't want to hang around them. They're so bummed out all the time. But they've got this disease, but I don't care because they're just so depressing. Well, try to cheer them up, do something, or recommend that they go see somebody for their mental health problems, right? Well, this article, I hope you will check this out. We might even talk about this through the next week on my shows, because I think this is so important. It says depression has been proven to be such a factor in cardiac disease that the American Heart and the AHA recommended that all cardiac patients be screened for depression. Myocardial infarction, especially those with prior episodes, should be both carefully watched and aggressively treated. An elevated cardiac risk likely in life. The cause of them to have these attacks, probably is stress, right? They're so stressful, they can't, they can do it. And so many people force stress, right? Whatever reason, people cause and dealt sometimes stuff to us, sometimes not directly to our behavior versus the people. And so, whether their family members or husbands, get help with that, it can just tell you a really good person. So read, well, we have about 15 minutes left here. I want to go down through here. They say that cardiovascular disease and mental illness, about 1 in 5 people will have an episode of major depression in their lifetime. And so that number is about 1 in 2 people with heart disease, right? So 1 in 5 people have major depression in their lifetime. 1 in 5. So if you know 5 people, one person who's probably had a major depression in their life. That number about 1 in 2 if they have heart disease. So this is very bad. So it's interesting that after testing the risk factor depression significant or ERHD research professor of psychiatry at Washington University School of Medicine in the St. Louis Center. That's quite interesting. Come to I don't get the realization that people with heart disease suffer from depression. 1 in 2 of them, so that's half. 1 out of 2, you have 200 people, you got 100 who will probably suffer with depression, and that's pretty sad. It's so sad. This is Dean Ornish, MD, wrote in his book, Survival of Faith for the Healing Power of Intimacy. It is, quote, a good predictor of imminent death, as smoking, obesity, or previous attack. Oh, it says predictor depression. Study shows that people are isolated or 3 to 5 times more likely to die prematurely. People connect he wrote the book Love and Survival, the scientific basis for the that's really and I want to talk more about coronary disease, the increased risk of dying or impairment in patients with coronary heart disease. In coronary heart disease, for patients with a history of myocardial infarction, heart attack, the prevalence of depression is estimated from 65%. And among patients with a history of heart attack, 18% have depression. Many depression with heart attack some greater risk can appear to add to patients still from heart disease. Can contribute to a worse symptoms as well as cardiac treatment. And people who survive heart attack suffer from major depression have 2 to 4 times greater risk within institute for depression. So that's I think that is nuts. And they go on to talk about cardiovascular. They said may be linked to certain or flight hormones, catecholamine, maybe related to heart attacks. This is according to Dr. Pauly. So anxiety surges. There's a whole fight or flight hormone called catecholamine that regulate heart attack. So anxious patients with coronary heart disease, CHD, may be less likely to seek preventive medical care due to an avoidant coping strategy. Well, that's me. I'm the anxious patient who doesn't want to go get help because I'm using the avoidant coping strategy. That's me all the way around, and I'll be the first one to admit it. Right? But I can imagine that fight or flight thing is not good for your heart. I remember being a kid and in so many situations, within our home that was just dangerous. There was a lot of violence in my home, and there was people screaming and yelling and beating on each other all the time. I grew up in a very abusive home. And then not only that, but just the whole lifestyle of the neighborhood was like that. And it just seemed that people were very violent, And growing up around a lot of that, you have this whole, it's whenever that chemical comes out, those hormones, that fight or flight thing, like when you get so scared that you can feel that adrenaline shooting through your body and you can feel it going through your veins. I mean, I don't know how many people have experienced that, but I've experienced that so many times that, it's really damaging. Excuse me, it's extremely damaging to you. It puts your heart at such a risk, and for many different reasons, right? I mean, there was lots of things that came up that weren't just within my house. They were outside at other people's homes that I experienced that at, and just different things in my life, throughout life that have come up that, that adrenaline, you get so scared that adrenaline just kicks in and your heart just almost stops because of the panic and the fear. And that's very, very bad. Those adrenalines and those catecholamine things that rush through your body, very hard on a person's body after a while. And I think people, I've actually donated my body to science. I did on the back of my driver's license. I have that I've donated my body for research because I hope they will take my books and my information and they can go through and they can use my body to sort of see the direct relation from child abuse to substance abuse to adult survivor issues. And I've actually gone ahead and just freely given my body to science because I hope that they can find some sort of help to sort of help more people and more doctors to understand the seriousness of child abuse and what it does to children, and then later on what people choose to do because of the abuse with substance abuse issues and not treating their bodies right, you know what I mean, as far as adult survivor issues go, and then the whole mental issues, the whole physical aspects of it, right? And so, yeah, I would hope people could, these scientists could get some more information and some more helpful information because I won't need my Earth suit. I'll be gone. So when I go, who needs their Earth suit hanging around? I sure don't. And I hope that my body can be useful and helpful because they can go through and they can see, like, from the time, they can go back and see the damage that was done from all the years before, not just from smoking or drug use, but from previous, just living in the type of environment that I grew up in. There's probably all kinds of interesting information that they can get from the heart and from the brain and different things like that, and the bones and whatnot. So I hope that they will be able to use my body and really get some good information from it, you know what I mean? But the thing is it does affect your body. It does affect your body. This whole living in fear, living in depression, living in sorrow and sadness and not being able to pull yourself out of it and not treating ourselves well. I still smoke cigarettes, and that's really my biggest vice, but I don't eat all that healthy anymore because I can afford to. Probably if I'd quit smoking, I could, but that's the whole issue is the smokes are keeping they sort of making me feel that I have some sort of sanity in my life right now with what's going on. And not only that, but it's an addiction, and I'm always addicted to something, whether it's illegal or legal, right? So that's the whole issue. Now I'm addicted to legal substances, but it doesn't matter because it's still an addiction, and it stems from the abuse that I suffered as a child. You bet it does. So some reasons why people need help, and so many times we don't have time, or we don't have people say, well, you have to make the time. Well, it's easier said than done. You know what I mean? At some point, maybe so. But we do all have to remember that all this stuff really that affects us is some of it's not our fault and some of it is. And if it is our fault, we need to change it. Like I need to quit smoking, see. And I'm still working on it. I did quit for 14 months, but it's a hard road. But as far as eating healthy, I used to always eat healthy, but that was back when I had money and I could afford to eat healthy. But now I'm eating whatever I can get my hands on that's cheap, right? So my eating habits have not been always the greatest lately, and as far as taking care of myself, I'm overtired most of the time, and I've got all these heart issues, and who knows what's going on in there because of I've been smoking since I was like 12 years old. You know what I mean? So it's very, very hard, right? It's hard on a person, this whole thing, and we just know so many people are suffering with this stuff. That's the sad part. It says it's also possible that a common underlying factor may increase the risk of both anxiety and heart events. But we know that ourselves, that when we're upset, all of a sudden our heart's pounding, or that you can't breathe properly if something happens that just really upsets us, or we just get so upset that we just start hyperventilating. I mean, I've seen this. I've actually experienced it. It says patients with stable coronary heart disease, CHD, plus generalized anxiety disorder, GAD, have a higher risk of experiencing cardiovascular events, such as a stroke, myocardial infarction, and death, than patients with CHD only. So, like, if there's anxiety disorder in there, GAD, of course, it just increases the risk. In fact, after for a variety of potentially confounding risks, associated with a 74% increased risk for adverse cardiovascular outcomes. That's general anxiety disorders. Thing is that I think what keeps me from having a stroke, really, to be honest with you, is just odd. And also, the fact that I think about I don't let things like people like my sweetheart terminally ill. And I try not to get upset. Like, after the time I don't have a job, and I don't know where my rent money is from. And, things like this, I'm and if I was to stop and let all this stuff get me, it'd be a mess. And keep out my job, it could really bum me out. But I just face it on a day-to-day day-to-day basis. I handle what I can handle. I think that what we have to do is realize that there's certain things we don't have control over, and then there's certain things that we do. And in my time to me, it's so important that I don't allow myself to get overwhelmed by too much stuff. And I know that all mine. I'm happy with what I have. I'm trying to get for a huge house. I mean, I have things, but happy just having a roof over my head and food in the fridge, right? I was a little bit concerned about them because I would like to be able to continue to look after them, but it always works out. You know what I mean? It's the whole thing. So I stop stressing over jobs. I hey, a job will come. If it doesn't, well, it doesn't. You know, it's just a good idea not to stress over things because we could just literally send ourselves into some sort of a psychosis by stressing over things all the time that we have really no control over, you know. And I think that's the most important thing is to realize that, hey, we really only have control of what we put in our body and what we do with our own behaviors. We can control how we act and behave. We can control what we do. We can control what we eat and how much sleep we, sometimes maybe not, but we can try to control how much rest we get. We really can't control what other people are going to do. We can't control whether or not we have a job or not. You could have a job today and not have one tomorrow. You know, but then again, you could have a better one the next day. See, so that's why I just try to keep a real positive outlook and remember that it's short and shorter for some people than others, and we got to do it and really take and control what we can control, which is our own behavior and how we see things. And I know all this stuff to really to tear us down. You know, that's what I mean. That's why I'm doing these firsthand. I know what it's all about. I know that it can be very, very hard for people. And so, you know, you have to almost just look at what you can do in your life and what you can do. Look at the good things that you can. They're really working well for you. Build on those, you know. Start to enjoy the little things. That's what it's really all about. And enjoy the time here and not stress over these. Because otherwise, you know, we'd be peaceful all the time, stressing over everything. Right? Important people just help with what they can, you know, and not worry too much about going on with other people because we can't control what they're doing. We only control really what we're doing and how we're going to take care of ourselves and how we're going to view this life and see this life, you know. And I like to look at the little things and be happy for the little things because it means friendships and good friendships and support from people. Just knowing, you know, people is just such a gift. You know, I find people are gifts to me. People in my life are huge gifts, and that's the best thing, you know. It's not about trying to get this or trying to get that. You know, it's about what I do in my life that I know that I have control over. Makes me happier, makes me feel good, and that's what gets me through the day. Otherwise, I'd be sitting around really depressed, you know, because I start looking around at what's going on in my life, you know, that other people might or might not see. If I just focus on the negative, of course, that's going to bring me down. You know what I mean? So we can't do that. We're responsible for how we feel, and so you know we have to look at we have to change that picture and turn it around and see something positive out of it. Right? So important. So. Yeah, we aren't going to have time to get through this article, but man, I hope you will check it out. www.wfma.org. And I'm going to pick this up next week as well. Really am. Maybe I'll have another special show for an hour or two. Another look at it. There's so much more to it. We're just barely on page 10 here, and there's 65 pages. But I did want to. There's a few parts to it that I wanted to look at. I don't know if, you know, like I said, we probably wouldn't cover the whole thing, but I wanted to look at the seriousness of depression and diabetes, depression and cancer. Depression and it relates with all the other stuff. Right? This is so important. So I hope you will take a look at this, and you know, if you know somebody or yourself suffering, you know, with depression or any type of mental health issue like PTSD, I know that there's help out there online. There's websites out there full of great information. You can join online support groups. You never even have to give your real name. You can just go on anonymously and just be part of that group that helps support people who are going through these harsh things. You know, there's support out there for people who are suffering with cancer and with all these different diseases. There's all kinds of support out there online. You can get involved with it and talk to people who are going through the same thing. They know what it's all about. They can help you, right? So make sure you do reach out and get some help. You know, don't suffer in sadness or silence on your own. It's too bad no place to be. Reach out and get some help. Right? If you know somebody that's suffering with this, I'm sure you're here for them. And you can your own means, without burning yourself. There's a second on that here, www.wfmh.org. So be sure and go there and check this out. World Mental Health Day today, October 10th, 2010. It's just awesome, and I hope to be able to see more stuff around here. This is what we need to see. See more on the less on the stigma of mental health. Hey, something about this. Get done. So thank you for tuning in.